Happy studying everyone. Today the topic of discussion is anti-leprosy drug. Under National Leprosy Eradication Program, the treatment strategy for leprosy eradication is based on multi-drug therapy. So it is very important to study about anti-leprosy drug. The main principle behind studying anti-leprosy drug is to prevent the development of not only the resistance but also the relapse of the reaction, and to convert the infectious cause into non-infectious as soon as possible to reduce the reservoir of infection in the community. We'll study this topic under following heading: introduction, epidemiology, clinical manifestation, classification, and lastly the treatment, in which we will study about anti-leprosy drug. So let's have a look on each and every content in detail. Introduction. Leprosy is one of the oldest bacilli known to the human being. Leprosy, it is caused by Mycobacterium leprae bacilli. It is also known as Hansen bacillus because it was discovered by scientists named Hansen. Mycobacterium leprae is a causative agent for leprosy. It is an ancient disease that remains as a social stigma due to its superstitious belief and characteristic deformity. So, leprosy, it is called as an Kushta Rog in Hindi. Now we'll study about epidemiology of leprosy. Source of infection. It may be multibacillary or paucibacillary. Among multibacillary, it may be lepromatous leprosy and borderline leprosy. Mode of transmission of leprosy is nasal droplet followed by contact transmission, breast milk, vertical mode, and also tattooing. Communicability. It is not a communicable disease, yet due to its social stigma, it is one of the controversial diseases known to the humankind. Clinical manifestation of leprosy. Leprosy involves cooler part of the body, but it can also affect any organ of our body, causing bony deformity and disfigurement in untreated cases. Incubation period of leprosy, it is 3 to 5 years due to longer generation time of lepra bacilli, which is 12 to 13 days. Clinical classification of leprosy, it is broadly classified into three categories: Ridley-Joplin classification, Madrid classification, and Indian classification. Ridley-Joplin classification include lepromatous leprosy, borderline lepromatous leprosy, borderline leprosy, borderline tuberculoid leprosy, and tuberculoid leprosy. Indian classification include lepromatous type, borderline type, intermediate type, tubercular type, and one important type, it is pure neurotic type, in which cranial nerves are involved. The most common nerve involved, it is ulnar nerve. Leprosy, it is a bipolar disease. What is meant by bipolar? It means that it has two extreme poles. The one, it is lepromatous cases, and the second pole, it is tuberculoid cases. In between these two extreme poles, there are three varieties of leprosy, which include borderline lepromatous, borderline, and borderline tuberculoid. Other varieties of leprosy are borderline type, characteristic in between tuberculoid and lepromatous leprosy. So, what actually borderline type of leprosy means? The characteristic feature of borderline leprosy lies in between tuberculoid type and lepromatous type. Indeterminate type, it is an unstable cases with one or two hypopigmented macules or patches. They are bacteriologically negative type. Pure neuritic type, neural involvement without any skin lesion. Lepromatous leprosy and tuberculoid leprosy can be differentiated based on bacillary load, which is multibacillary and paucibacillary. Bacteriological index of lepromatous leprosy, it is 4 to 6, while it is 0 to 1 in tuberculoid type. Skin lesions are symmetrical, irregular, multiple nodules, plaques, and xanthoma-like papules, leonine faces, and eyebrows are more commonly seen in lepromatous leprosy, while nerve lesion appears late in lepromatous leprosy. Lepromatous leprosy comprises of cell-mediated immunity, which is of low type, while it is normal in tuberculoid type. Humoral immunity is exaggerated in lepromatous leprosy, while it is normal in tuberculoid leprosy. Foamy type macrophages are seen in lepromatous leprosy, while epithelioid cells are seen in tuberculoid leprosy. Langerhans giant cells are found only in tuberculous type of leprosy. They are not seen in lepromatous type of leprosy. So this is how lepromatous leprosy and tuberculous leprosy is differentiated. Tuberculous type and lepromatous type are the two extreme poles of leprosy, while as borderline tuberculous, borderline, and borderline lepromatous are the in-between type of the leprosy. And the tuberculous type of leprosy is considered to be the one with good prognosis, while as lepromatous leprosy have bad prognosis. As a result, all the characteristic features of lepromatous leprosy are very extreme. This is the diagrammatic representation of all types of leprosy. In tuberculous type of leprosy, the lesions are saucer shaped, while as in borderline type of leprosy, the lesions appears to be an inverted saucer shaped type of leprosy. The lesions are more prominent in lepromatous leprosy type, while as hypopigmented patch are seen in borderline tuberculous type of leprosy. So this is how we can differentiate various lesions of leprosy. What are the deformities which are seen in leprosy? The causes for deformities are due to nerve injuries, disease process, infection, or injury. The common deformities on face, leonine faces, which are nothing but the line-like faces, sagging faces, loss of eyebrows, eyelashes, and corneal ulcer. Hands appears claw-like, so they are termed as a claw hand. While as wrist drop, it is also a common feature. In feet, we are able to see foot drop. This is how the leonine faces of leprosy look like. Just have look on the image. The person suffering from leprosy appears as if he has an characteristic features of lion. So they are termed as an leonine faces. Leonine faces is a characteristic feature of lepromatous leprosy. Along with that, this we can also see sagging. Also, there are nasal deformities, sagging of eyelid or eyelashes. This is how the claw hand look like. This is typically termed as an claw hand of leprosy. Claw hand can be caused by various another type of manifestation, but in leprosy, the claw hand is also one of the features which we prominently see. So this is how leonine faces and claw hand which look like in case of lepromatous leprosy. The common question which is asked regarding leprosy, it is enumerate different types of leprosy drugs, give mechanism of action of dapsone, and describe one multi-drug regimen for treatment of multibacillary leprosy. So this is the core topic of discussion, that is anti-leprosy drug. Anti-leprosy drugs are further classified as an sulfone, which include dapsone, phenazine derivative, which include clofazine. Antitubercular class include rifampicin, ethionamide, and proethionamide. Other antibiotics which are used in leprosy are ofloxacin, minocycline, clarithromycin. So this is how broadly the anti-leprosy drugs are classified. Sulfone, that is, which include dapsone, is one of the most important drugs used in treatment of leprosy. Dapsone, it is also known as diamino diphenyl sulfone. Sulfone itself tells that it belongs to the class sulfone. It is the simplest, oldest, most active, and most commonly used anti-leprosy drug. So this was all about introduction of dapsone. Now we will see the mechanism of action of dapsone. The mechanism of action of dapsone include dapsone, it is chemically related to sulfonamide and has mechanism of action as they are structural analog to PABA. It inhibits bacterial folate synthetase which involve in conversion of PABA to folic acid. This causes folic acid deficiency resulting in injury to the bacterial cell. So what does dapsone do? Dapsone inhibits the conversion of PABA to folic acid. As a result, the bacterial cell wall lack folic acid and that results into death of that bacteria. Along with this, dapsone also competitively inhibits the union of PABA with petridine residue to form dihydropetioic acid, which conjugate with glutamic acid to produce dihydrofolic acid. As a result, it also gets incorporated to form an altered folate form, which is metabolically injurious to the bacilli. So, what does PABA do? PABA acts based on competitive inhibition mechanism, and as a result, it results into formation of a toxic compound of dihydrofolic acid, which is dangerous to the leprosy bacilli. Multibacillary regimen of leprosy is included in lepromatous leprosy, borderline leprosy, and borderline lepromatous leprosy type. It was invented by World Health Organization in 1981 and implemented under National Leprosy Eradication Program. Drugs used are dapsone, rifampicin, and clofazimine. WHO recommended following standard multi-drug therapy regimen in 1994 as a fixed drug therapy of 2 years for multibacillary, whether disease is active or skin smear negative is attained or not. Rifampicin is given 600 mg once a month under supervision. 100 mg dapsone given daily. 300 mg of clofazimine is given once in a month under supervision, while as daily 50 mg is self-administered. Advantage of multi-drug therapy: it is effective in case with primary dapsone resistance, prevent emergency of dapsone resistance, afford quick symptomatic relief, and rendered multibacillary leprosy cases non-contagious. It reduced total duration of the therapy. So, multi-drug therapy are used in order to prevent the resistance and also to prevent the duration of the treatment for leprosy, because the duration of treatment is very long. As a result, patient is not compliant with the therapy. In clofazimine is not accepted nowadays because of the skin pigmentation. So it is one of the side effects of clofazimine that it causes pigmentation. As a result, patients do not want to use it. So what is the alternative for clofazimine? It is ethionamide 250 mg daily plus isoniazid 300 mg daily, which is self-administered. Minocycline ofloxacin are also used. Now we'll look about lepra reaction. Lepra reaction is of two types, type 1 and type 2. Type 1 comes under type 4 hypersensitivity reaction, while as type 3 undergo type 2 lepra reaction. So here we apply rule of 5, that is type 1 lepra reaction, the hypersensitivity is type 4, and for 2 it is 3. It is seen in borderline leprosy and lepromatous leprosy respectively. Lepra reaction, the treatment for lepra reaction, it is steroid in case of type 1 lepra reaction, while as in case of type 2 lepra reaction, it is thalidomide. Other organs are not involved in lepra 1 reaction, while as in lepra 2 reaction, eyes, testes, and kidney are involved. WHO treatment based on clinical classification. Based on clinical classification, leprosy can be divided as an paucibacillary and multibacillary. It is based on the skin lesion. Skin lesions are 1 to 5 in case of paucibacillary leprosy, while as in multibacillary leprosy they are 6 or more. Nerve involvement, it is 1, while as 2 or more nerves are involved in multibacillary leprosy. Microscopy: smear negative is paucibacillary type of leprosy, while as smear positive is multibacillary type of leprosy. The treatment for paucibacillary leprosy include dapsone 100 mg given daily, rifampicin 600 mg given once a month under supervision. In multibacillary, dapsone is given daily 100 mg, rifampicin 600 mg under supervision, clofazimine is given 300 mg once a month under supervision, and 50 mg daily self-administered. Follow-up for multibacillary leprosy, it is annually till 5 years, while as it is annually for paucibacillary for 2 years. Prevention of leprosy, active case finding, and effective treatment of the cases. This is the most important strategy in prevention of leprosy. BCG vaccination have also proved efficient in case of 28 to 60%. Chemoprophylaxis with dapsone can be given to all close contact of leprosy. Hospitalized patient need not to be isolated because transmission requires prolonged contact. So this was all about anti-leprosy type of the drug. We have seen how leprosy is treated. Before that, we have also seen how leprosy is classified. What is the causative agent? Leprosy it is also called as an Hansen's disease because it was discovered by scientist named Hansen. In Hindi, we call it as an Kushta root. Thank you. Please like and subscribe my channel.